And Doctor, once again, pleasure meeting you. And
Likewise.
why don't we start off with a brief introduction of yourself?
Well, my name is Robin Schoenthaler. I'm a physician in Massachusetts, and I live in Arlington, where I've raised my two sons who went to Arlington High and now are out in the Metro Boston world.
Awesome. I've read a little bit about your background, and you certainly had a long, extensive career in the medical field, starting, when was it? Would it be safe to say 1997 when you, actually, no, even before that, is that correct?
Yeah, that's correct. I
Can,
started out my medical career driving an ambulance in Oakland, California, and I eventually went to medical school, also in California, and did a residency in radiation oncology, which is giving radiation to cancer patients. And then Mass General recruited me in 1992 to work in their department. And I worked in their department's satellite clinics in Boston, in Waltham, and mostly in Concord at Emerson Hospital.
and you've certainly gathered a lot of accolades in relation to your medical career. But another thing about you is that you're also a hobbyist for writing, creative
Right.
writing, short story writing. You've also been writing a lot of articles. So, how did you manage to find that passion while also doing radiology oncology? Please correct
Exactly.
me on my
Radiation
terminology.
oncology, exactly.
Radiation oncology.
That's perfect. About 15 years ago, I started writing. And I mean, I'd always been a writer and a letter person and that sort of thing, but I started writing and then eventually writing for publication. And a lot of the writing that I did was to sort of process all the things that I was learning in the cancer clinic. And then it began to be sort of teaching about what I learned in the cancer clinic. And then it expanded into, sort of interesting things that happened in our lives and in Arlington. And yeah, it was really super fun to write and then also be read. Turned out I liked being read. And then in the last few years, that's actually expanded into storytelling. And that turns out to be as much fun or more so than writing, because you're still telling stories, maybe teaching things, and you have an immediate audience in a live audience in a crowd. So that's been a great thing, and culminated in the third or fourth best night of my life when I won the Moth Grand Slam Championship. That was a really great day. Lots of Arlingtonians there too.
And that was in 2019, right?
Yeah, in March. Regrettably, now there's hardly any audiences for storytelling, but we'll be back.
Right. What are the kind of stories that you tell for these, for just for fun, and also when you're going to do these story slam things? What is the main focus of your storytelling?
Sometimes it's about the cancer clinic, because there's so many life lessons there. Sometimes it's stories, slice of life stories. I have several stories about being called to medical emergencies on planes. I have several stories about my children and lessons learned from life and death. So it's sort of across the gamut. Some are funny, some are really moving, some are somewhere in the middle. But it's great. It's great to have an audience, and it's the common humanity gets felt very wonderfully. And we've had particularly great experiences at Kickstand with Emily and Mark have opened it up to a particular storytelling mode called fugitive storytelling. And we've just had great stories there.
So you've been managing your time very well between being a radiation oncologist and being a storyteller. That is quite fascinating.
Thank you.
And in March 2020, when the first news of coronavirus broke out of Wuhan, China, you call yourself COVID obsessed in that regard, in terms of just diving right into the scientific facts and looking at all the stories going around. Can you go more about what it means to being COVID obsessed?
Yeah, now I call myself a COVID translator, but it definitely comes from being COVID obsessed. It's a couple things. One was my medical training was very much hugely influenced by the AIDS and HIV epidemic. It was literally bookended. We didn't know what the disease was at the start of my medical training, and we had tests and the very earliest of treatments at the end of my training. And since my training was like 12 years, that was a long time to watch an epidemic come and go. And I had 1 million AIDS and HIV patients. And that's a hard thing for a young doctor, to have the majority of your patients be terminally ill at that time. So my way of I had several ways of coping with that kind of a very tumultuous training. And one of them was to learn about the history of epidemics. It was really important to me to see what was going on with AIDS in the context of history. So I became quite immersed in studying epidemics, and I ended up writing a big paper in a history of medicine class on the history of yellow fever, of all things, in New Orleans, of all places. But it was hugely helpful to me to be able to see the same patterns happen over and over again. And so when this started, once it became apparent that it was not going to be just another H1N1, another thing that we were afraid was going to be a pandemic and then dissipated. Once I realized that, then I found all those same interests sprang back up, and all my my sort of interest in seeing how this pandemic was going to fit into the history of pandemics, that came up. But the other thing that came up was that we had so much either over information or misinformation about what was going on in other countries. And in my role as a physician, I had access to a lot of sort of on the ground. I had friends of friends who were physicians in Italy, and friends who were working in New York. And I was and I knew of people in China, and I was quite alarmed right away. I mean, I was quite alarmed to put this in a timeline context, Massachusetts closed down the weekend of March 13th, and I was really alarmed by basically March 1st. So during that whole 2-week period before we actually closed down, and I could sort of see it coming, and I was hearing from these doctors in other countries about how terrible it could get, and I realized that it was inevitable that it was of course going to get that terrible for us as well. And so the way that the writing about COVID started was basically on the heels of reading one too many horrifying emails from Italy. On a Friday night, I had a glass of red wine and wrote a short little note to the Arlington Facebook page saying, and so this would have been on March 6th. And saying, you guys, this is coming. I don't care what you're reading in the paper. I don't care what your sister-in-law in Milwaukee says. I'm telling you, this is coming, and it's going to change our lives. I mean, I had no idea how much it would change our lives, but I knew it was going to change our lives for, I think I said, a few months. And I just sort of put out a warning, and I'd already started, and that particular warning was that older people and people with complex medical conditions should start staying home, which was what? Everybody's what? But I just felt this very strong need to start warning people that it was coming. It was already here, but it was definitely coming. And I started doing that with my friends as well. I mean, I remember we were in the early days of some local political campaigns, and I talked to some friends about not having fundraising parties, and I talked to churches about not holding in-person stuff. So all of that was going on for like those 10 days. But the big thing that I did was that I wrote this letter to the Arlington email list, which hardly anybody paid attention to, but a couple people asked me some medical questions about it. And so over the weekend and the following weekend and the following weekend, I wrote longer little essays for the Arlington list where I just said, I'm a doc and I know how to talk about symptoms and I know how to talk about when to go to the hospital. So here's the basic information. And so I just kept doing that. And two things happened. One is that people started expecting it. Like I remember there was one Saturday night where I was walking around my neighborhood because I started to become one of those pandemic walkers, just constantly walking. And a couple of neighbors came out while I was walking and they were like, hey, it's Saturday. Aren't you going to write something? I was like, oh, well, I wasn't. I was going to go home and cook or something. But anyway, so that happened. And then the other thing that happened was that I fully expected every minute that the CDC would step up and give out very clear direction and guidance. And you wouldn't need somebody like me. But they never stepped up until maybe this week. So there I was in this vacuum. There was not good information coming out, and it turned out lots and lots and lots of people were starving for good information. So after, maybe 6 or 8 weeks of writing something weekly, I started to get some sort of philosophies about it, because none of this was intentional. It was just, I'm just helping out my neighbors. But I started to get intentional that it wasn't going to be about politics. It wasn't going to be about blame. I wasn't going to get into who's right or who's wrong. It's just, these are the facts. And then behind that it turned out that I really wanted to teach about how science works. And one of my philosophies in all of this is that the science will save us, which was a big shock to a lot of people. I mean, I think a lot of people thought this was not a salvageable situation. Or I'd say I have several mantras, and another one is all epidemics always end. That's what I learned from the history of epidemics, from all that studying. But a lot of people didn't know that. I mean, it had not occurred to, of course, when I said it was like, oh, of course they do. But so those kinds of things that were just sort of intuitive to me turned out to really help people a lot. And so I started, sort of concentrating on the practical, and then sort of this is how science works. And this is why I love science. And then sometimes I move in other directions as well.
So what a process to get to where we are now. You just started out as writing things to the Arlington list, which it just gets longer and longer for the sake of your neighbors. And then you just felt the need to provide good information that people, especially your peers, find reliable. Is that when you started creating your own blog post on the platform Medium?
Yeah, a lot of people don't want to be on Facebook, or their friends in the Midwest aren't on Facebook and they wanted to share them. And so I found Medium. And all along the way, people in my audience would step up and help. So people helped me figure out how to be more public on Facebook. People helped me figure out how to sort of expand into Twitter some. And then the big thing was Medium. Several people stepped up to help me become more accessible on Medium, which is just, it's like the Huntington Post or Salon or Slate or something. Except that it's not edited by somebody. I mean, I now have editors that help me, but in any case, Medium definitely expanded the audience. But I'll tell you what, people say Facebook is dead, and I have a huge audience via Facebook. I mean, it's just incredible how, every week I see that, it's gone to some church newsletter in Wisconsin, and some hospice organization in Arkansas, and some French mission in, or what do you call it, monastery.
Quite the reach.
I've heard from Monaco, I've heard from France, I've heard from Uruguay, I've heard from all over the world. It's amazing, because it's easy, just press share and there you go.
Yeah, because there's also this feature in Medium that if there's a star right next to your article, that means the site administrators at Medium like it, and they'll decide to share it on their behalf on like just a regular news feed. It's like sort of a promotion.
Yeah.
It's a popular read.
Yeah.
And I guess it does prove that it's effective, given that it provided you such a large range of audiences.
Yeah. And I never know what's going to click, or what people are hungry for. I'll check midweek and oh my God, 20,000 people read that article. And then the next week it's like 800, for a different, so I never know, but I'm not, trying to, sell them or anything. So it doesn't, the numbers don't matter. It's what people need to know. And I keep thinking, every month I'm like, well, I'm sure the epidemic's going to wrap up but there just keeps being more stuff. So there's like every week.
There was this one article that you wrote that was very popular. It was featured on many different platforms. I think it was featured on the Boston Magazine, if I'm not mistaken, but also
the
Business
Boston Globe, the
Insider.
Thanksgiving story.
Yes, the Thanksgiving story.
Yeah, that was a big deal. Yeah, and then it went on to Boston Insider. And let me tell you, not Boston Insider, Business Insider, Boston Outsiders. And I thought it was some little Boston. Yeah, it's not. It's like huge. And it was MSN and Yahoo, and my, nieces in Northern California are like, Aunt Robin, you're famous.
Yeah, it was
so that was the big, the Thanksgiving. So that was a kind of interesting thing where, I wrote several columns on how to be safe for the holidays. And it was another kind of thing where I sort of evolved while I was doing it. Like at first it was like, here's the facts, Jack. This is what you should think about making plans for the holidays. And then as our numbers were going up and numbers around the country were going up, and it became, airplane reservations were going up, it became clearly more dire. So I think the first one I wrote was sort of, here's the facts. The second one was, you should really, really, really think about not having a big Thanksgiving. And the third one was, stay home, right? So I sort of went through that. Then we held our own Thanksgiving and followed 80% of all of the advice that I had given in all these columns.
The advice that you didn't follow just happens to be not having a Thanksgiving dinner, but
at all.
That's about it. Yeah, no, you wrote that you followed so many strict protocols that your family followed, just the three of you. Can you just reiterate that, please?
So basically what we did was we said we want to have the safest Thanksgiving we can possibly have following the science. So we'll all, mostly stay home for a couple of weeks before we get together. We'll only be together for a couple hours. We'll sit really far apart. We'll have masks on all the time, except when we actually have a fork in our mouth. And we'll cook at home, so we don't spend hours in the kitchen together. And we'll just do this tiny little Thanksgiving, and we'll still be together, and it'll be wonderful. Well, it would have been wonderful, except for 48 hours later, my oldest son got COVID, which meant that not only were we devastated that he was ill, but it also meant that the other people in our little family had been exposed when he was contagious, since the hallmark of COVID is that you can spread it when you don't know you're sick. You're contagious for at least several days before you manifest any symptoms. So what happened that week was that, we were very upset that my son was sick. It was very disruptive in his household. He was ill, so all those things were bad. And at the same time, his brother and I both got tested, at least twice, to make sure that we didn't get it, which is wonderful. It showed that the science there did work. But the reality was that neither Kenzie nor my other son, Cooper, had truly stayed home completely for 2 weeks. They'd mostly stayed home. They'd mostly been very safe. But as one of our readers pointed out, mostly bubbled is completely not bubbled. It's not, and saying you're mostly safe is not 100% safe. So we really had, so once we knew that we were negative and that Kenzie was getting better, once we were sort of out of the health crisis, then we all started talking about having me write about it, because it was just such a powerful lesson. And Christmas is coming and New Year's is coming. And so, it's still sort of applied. It's a little different now, because now we're not having quite the impetus for big get-togethers. But anyway, so I decided to try to write about it. I wrote about it and that's the other thing, the Arlington list has continued to be sort of a testing ground for me. So I wrote about what had happened with us with Thanksgiving for the Arlington list. And people were extremely strong responses, mad at me, upset for us, changing their Christmas plans. It was a very, very strong response. And so on the heels of that, I decided to pitch it to the Boston Globe. And that took a couple days, but they ended up publishing it that week. And then, as I said, Business Insider reached out to me, another outlet called Scary Mommy, which has 8 million followers on Facebook. They took it too. And so we were really, all of us were really glad about it, even though we came in for criticism. That's fine, because the criticism is reasonable. I said, have a science safe gathering, and then I didn't do it. So anyway, the main thing was that I think a lot of people learned from it as much as we learned from it. And it was and it's always fun to be read.
Right. So what is your overall goal of being a writer? Like, where do you see yourself?
Talking to you, I'm realizing I am into sort of insights. I like teaching. I like expanding people's worldviews. I've been genuinely shocked at the lack of science education, and how much stuff to me is just, intuitive, and other people have never heard of it. It's something like phase 1, 2, 3 trials, clinical trials. Like, I always thought everybody knew that. No. But the other thing is that it's really brought up a lot of stuff from the cancer clinic. It's reminded me a lot of lessons that I've learned there about everybody has their own risk tolerance, their own risk thermostat, and people interpret risk in really very different ways. And so it's been interesting to me to approach that as a writer. How do you talk about risk, and how do you convey risk?
Doctor, I'd just like to ask you for any additional comments that you'd like to touch upon before we conclude this interview.
Sure. A lot of people have lately been asking me about the variants, because they're getting a lot of press. So the variants are versions of the SARS-CoV-2 virus that have mutated in a way that the viruses mutate. They live to mutate. I sort of liken them to squirrels, right? Squirrels, all they do 24 hours a day is try to find food, right? That's why they drive you crazy. Well, viruses, all they do 24 hours a day is mutate. They're just constantly reproducing, and when they reproduce, they mutate. And most of the time, it doesn't matter at all. But occasionally, a mutation or a set of mutations will happen that make us nervous. And so there's been some, and so one of the ways that that viruses commonly mutate is they mutate to become more transmissible. They want to be in more bodies. They don't necessarily want to be more fatal, because then the bodies that they're in will die and they won't have a host, and that's not good for them. They want to keep reproducing. That's their goal in life. So while it's normal to have a virus become more transmissible, more contagious, what we don't know yet, and that has happened, there's a number of varieties called variants that are showing that they probably are more transmissible. Then we move into the devil of the details. We don't know whether they're more lethal, probably not. We don't know whether our tests can pick them up. They probably can, but it's okay. You okay?
Yeah, it was just a sneeze.
Yeah, we don't know if they're going to be more not easily picked up by our tests. They'll probably be fine, but we don't know that yet. That has to be studied. And then most importantly of all, we don't know whether any one of these variants might be something that could, quote, escape from the vaccine. It's unlikely, but it's possible. And so all of these things we're going to have to continue to study really closely. And before we can even do that, we're going to have to come up with more infrastructure to deal with variants, which means more testing of tests, more testing of vaccines. But we'll do that. That's all part of the scientific process. It's just every one of those variants is a potential headline that has the potential to freak everybody out. So, but I think the important thing to know is that they're going to be followed, and they're going to be continued to be evaluated. It's not unexpected, so people are already carefully watching what's going on. And once again, even if it does turn out that we get a bad variant that turns out to be more transmissible or more easily able to escape from our vaccine, the science will save us.
Right, your philosophy.
Yeah.
Science will save us. And for more educational material about the process of this whole pandemic, I would assume that you'll be constantly writing about these things for us to read and learn.
It's like I said, I'll keep writing as long as people, as long as I'm not, as long as there's something to write about, and as long as I continue to have this wonderful audience. So yeah.
All right, Doctor, I think that will do it for this interview. Thank you so much for sitting with me and speaking all about your experiences.